Thanks again, Marie, for inviting me here again to present today. As Marie said, my name is Rachelle Kosokowsky. I'm a clinical oncology social worker at the Saskatoon Cancer Centre. It's my big fancy title. I know a few of you. I'm lucky enough to have had a lovely relationship with the Prostate Cancer Support Group for some time now. So I'm always very fortunate to always be invited back to chat. So yes. Talking about the emotional impact and the mental health impact of prostate cancer today. My presentation today is fairly generalized, of course. I am leaving cards here today. I'm leaving a bunch of different sort of handouts of different tools people can use. So help yourself to some of those. Of course, I will leave time for questions at the end here, but certainly if you have something burning, absolutely, I can stop in between here as well, too. So, okay. Oh, it works. Excellent. So yes, just a little overview of today. We're going to identify some of the emotions that can accompany a prostate cancer diagnosis and or prostate cancer treatment. Examine why these emotions might be occurring, and discuss some ways that might be of benefit for coping and helping with some of those emotions. So you gentlemen and ladies in the audience here today are probably all too aware of the physical impacts that can accompany prostate cancer and prostate cancer treatment. The fatigue, the sleep disturbances, can be irritation to bowel and bladder depending on your treatment, hot flashes depending on your treatment, erectile dysfunction, decreased libido, hormonal changes. But we don't often talk about the emotional impact as much that these physical changes can be connected to. So some of the emotions that may accompany these physical side effects: shock, fear, anxiety, sadness at the initial diagnosis, frustration and disappointment at changes and disruption to your life, stress. What is the treatment? Will it work? Will it not work? What will happen to my work? Where will income come from if I have to stop work? Changing identity, becoming a patient and a caregiver, feeling alone, embarrassment with mood changes, sexual function changes, some guilt, low self-esteem, a lot of different emotions that can come out of this experience. And when we have distress, it can be displayed in a variety of different ways. Physically, when we're having distress, it might come out as pain or fatigue or sleeplessness. Emotionally, we might experience that low mood. We might experience anger or anxiety. Spirituality, we might be feeling a loss of direction or purpose. Cognitively, distress can be allow you for forgetfulness changes, brain fog sometimes, interpersonal relationships, withdrawal and isolation, behavior, avoidance, disagreements, diminished self-care, things like that. Now, we often talk about different emotions, but this is something that can be sort of a strange and different topic for gentlemen. Often when we talk about men, we don't often talk about emotions. Especially of one generation, a lot of men were raised that you hid your emotions. You didn't talk about your emotions. That displaying any emotionality might equal weakness. So we have this social development, this social upbringing to equate emotionality to being bad or wrong. But emotions aren't bad or good. They're just emotions. It's what we do with them. And emotions as humans, that is our way of expression. That is how we get things out into the world. So tears are an automatic nervous system function. They're not necessarily a bad thing. They're just how we relieve stress, how we relieve anger. So it doesn't have to be a bad thing. Emotions are not necessarily a bad thing. For example, for some gentlemen starting on androgen deprivation therapy, the hormone therapy, you may feel a sense of increased emotional lability. So emotions more near surface level. Easier to anger, easier to cry. You watch a movie that you've never cried before at, and suddenly you're in tears, or somebody cuts you off and that never used to bother you and suddenly you're in a rage. Well, it's not necessarily a bad thing to have those emotions at surface level. It's just unfamiliar. What I'm going to talk about a little bit more in the following slides is when that does become disruptive to our lives and when we do have to start doing something about it. But having that emotionality is not necessarily a bad thing. It's unfamiliar, I'm very sure, for many people because you may be used to sort of stifling those emotions or not talking about those emotions. But having that emotionality and displaying that emotionality isn't necessarily bad. We've had a lot of partners come and talk to us and say, you know what, I like this side of my loved one. I've never seen this vulnerable side of my loved one, and I actually feel a connection because of it, an emotional connection because of it. So again, not always necessarily a bad thing, but I will talk about, sort of like I said in the following slides, about, okay, when emotions become more difficult to process and what we do with that. So, studies, literature. If you want sort of numbers and are a research fan, here's some sort of data for you. So there's a study that was done by Lintz and Moyhoyen and Stigera in 2003 with 210 patients, and they showed the primary unmet needs with prostate cancer patients were fear about the cancer spreading, concerns and worry about your loved ones, those closest to you, and concerns about changes in sexual function. There was a study done in Jefferson Cancer Centre conducted in 2013, which determined that multiple unmet psychosocial needs of prostate cancer patients. The top ones, again, included fear of cancer spreading, fear of the cancer returning, concern and worry about loved ones again, uncertainty of the future, and concern about the ability to have loved ones to cope. So it's clear that there are psychosocial needs. It's clear that our gentlemen have mental health concerns that we need to be addressing when it comes to prostate cancer here. Again, unmet emotional needs. Study by a cancer center and US2 survey on depression and anxiety in gentlemen with prostate cancer, about 500 people. 78% experienced symptoms that are hallmarks of depression and anxiety. Only 36% felt very confident that they could accurately identify symptoms of depression, and 41% expressed that they had some support from healthcare professionals to manage these symptoms. So that's a big gap there. So yeah, we need to be doing a better job of incorporating that in our standard discussions, in our communications about prostate cancer, that this can be part and parcel of it. And this, just like our physical health and physical recovery and treatments, also needs to be looked at and treated and addressed too, to have sort of holistic health. So let's talk about depression first. What does depression look like? What is depression? Well, it can be feelings of sadness, emptiness, hopelessness, usually hallmarked by a loss of interest or pleasure in things that you would normally find interesting and pleasurable. Might come out as angry outbursts, irritability and frustration, especially towards loved ones or those close to you. Sleep disturbances, so either sleeping too little or way too much all day. Tiredness and lack of energy. Maybe reduced weight loss or not eating, or the opposite, increased weight and increased eating. Anxiety, aggression, and restlessness, feelings of worthlessness or guilt, and trouble concentrating and making decisions and remembering things. That all can be signs and symptoms of depression. Now, what does that depression look like? Well, we might want to look at it and see, is this something that is situational? Is it circumstantial? Am I having sort of a few down days or a few tricky months when your prostate cancer diagnosis was just diagnosed, or when treatment is about to start, or when treatment stops and you're leaving sort of the comfort of your treatment medical team? Is it sort of surrounding situational things? Or is it an ongoing, everyday thing that has been lasting for a good time, a long time? Are you waking up every day with any changes to that mood? Or is every day feeling very dark, very hopeless, every day seeming not interested in anything enjoyable? So looking at whether it's situational or whether it's ongoing. So you might want to look at something called the PHQ-9. That's basically a little evaluation that healthcare providers will use to determine, is this an ongoing diagnosis of depression? Is this something that we do want to consider some counseling support or medication? Or is this something that is quite situational and it will change from sort of week to week? So looking at that, what do we do about depression and feelings of darkness or sadness or hopelessness? Well, first of all, we want to spend some time acknowledging those feelings, putting it out there in the world, expressing that. And that can look different for everybody. That can be verbally, so speaking to your friends, your family about it, speaking to a professional about it, a counselor. It can be journaling. It can be writing things down, whether that takes the form of a notebook, of a diary every day, whether that takes the form of sort of jot notes on a little piece of paper, whether that is on a little sticky note and put in a box. Way of getting it out. Some people like to do art or music as a way of expressing their feelings. So first and foremost, we have to get what's in here out there, because the thing we don't want is it to keep compiling. We don't want to bury it, because it doesn't go away. When we sweep things under the rug, the dirt doesn't go away, it just stays under the rug. And probably, yes, yeah, FYI, Murray, in case this is news to you. So yeah, we don't want to keep sweeping it under the rug, because what happens when we keep sweeping it under the rug? The mound of dirt gets bigger and bigger and bigger, and soon you have a giant pile of dirt under that rug, and maybe even a big bump at some point there. And then what happens when you walk over that rug? Well, if you walk over it and you take a big step, maybe poof, the dirt goes flying on either side, and you get a giant smoke of dirt surrounding you. I hope that's not what's happening at your house, Murray, but I'm a little worried now. So we don't want to sweep it under the rug. It's easier if we get that little pile of dirt and we bring it out and we put it out there and we do something about it, so we don't have that pile up of the dirt that explodes when we least expect it. And that's what happens with our emotions like sadness or anger or depression. If we keep putting it under the rug, at some point it's going to burst out. And oftentimes it'll burst out at a time we don't want it to, and towards people, towards our loved ones because they're close to us and we see them most often, and those we don't want to hurt. So important to get that out there in a way. Next, we want to look at the situation and see if we can reframe things. So are there some cognitive behavioral techniques? Are there some tricks that we can do with changing our frame of thinking, changing how we look at that situation? Maybe we can reframe it and find some positives or little bits of light in the situation. Is there anything about your journey through the prostate cancer diagnosis that was good? Maybe it was seeing the world in a new light. Maybe it was understanding what other cancer patients or other people with ongoing medical diagnosis go through. Maybe it was finding a closer connection to certain loved ones, or finding out who isn't necessarily a go-to resource. So maybe there is some light that comes out of a dark situation. So looking at some of those, reframing certain situations to see if we can pull some light out of that. Having a regular routine can be really important in terms of helping to combat depression. So getting out of bed every day, even if we don't feel like it, taking a shower every day, looking after ourselves, making sure we get some healthy nutrients in us, and doing a little bit of exercise in our week as well. Now, when I say exercise, I don't mean you have to go run a marathon, especially if you've never done that before. I don't advise that for anybody. But something that is workable in your own life. So maybe that's a walk around the block. Maybe on days when it's -40, maybe that is just going around your house, up and down the stairs a few times. Maybe it's a walk in the mall. Something that is manageable for your own routine, because we know that exercise has a connection to endorphins, positive endorphins. And so that can help overall with a positive mental health, doing some regular exercise in our life and having a regular routine in our life. Even on those hard days where we don't feel like getting up out of bed, well, maybe we do the littlest things that day. Maybe it's just getting up, getting out of our pajamas, having a shower, and doing something we enjoy, whether that's a bath or reading a book or some cuddling with our pet, something like that, but having a bit of a routine to our day is really helpful too. Ongoing, if our depression is ongoing, like I said, if you had a lot of those symptoms that I mentioned on the last slide that are ongoing on a regular basis, so it's been 3 weeks now, or you have significant feelings of hurting other people or hurting yourself, this is where you need the help of other people. You need the help of your medical team. You need some professional counselors to come in and help support you as well. Ideally, we would do this before we got to that point. We like to be, as counselors and therapists, we like to be like car mechanics. We like to see you before you break down on the side of the road. We'd rather do the regular tune-up and maintenance sort of, every month or every 3 months or things like that. And that's not a money grab. It's just, it's easier to continually do the maintenance than fix you when your car's totally broken, right? So yeah, we'd rather sort of see you before that point, but absolutely, if you've got those feelings of harming self, harming others, then yeah, we need you go to the hospital, contact your medical team. There might be a role for some antidepressants. Many of you I might have talked to about Effexor. Effexor is an antidepressant, and another byproduct of that is that it seems to help with hot flashes. So folks on the androgen deprivation therapy, that may be a good fit for you because it hits sort of two things at once, the hot flashes and the depression. But that's where your medical team comes into play because it has to be a right fit for you and what your medical needs are as well. And that's, like I said, where our counseling and therapists come into play, myself and my other social work colleagues at the Cancer Centre, or there's many community counselors out there as well. That can be a good support, checking in, seeing you regularly for some therapeutic counseling as well here too. One really helpful technique that I've left handouts there too. Some people ask me, well, how do I journal? I've never journaled before. What does that look like? Well, there's a really good method called the Pennebaker method. If any of you listen to a podcast called the Huberman Lab, this was featured on there one time. But it's a nice method of journaling where you freestyle journal, so meaning you put pen to a paper or type on a computer for 15 to 30 minutes. And it says for 4 consecutive days, or you can do once a week for 4 weeks. And you pick a topic that is most troubling for you, that is causing you that depression or anxiety that's most unsettling for you. And you free flow journal. So meaning you try not to edit yourself, you just put the pen to the paper or to the keyboard and you go. And you try not to, correct your errors or grammar, you don't worry about that. And you see where that takes you. And they've done studies and found that this has really led to positive results, not only for the short term, but the long term as well. So if you're wondering more details about that Pennebaker method, I've got some handouts there too. So this is that PHQ-9 evaluation that I mentioned. This is that sort of standardized evaluation of depression that most medical facilities use to kind of gauge where your depression levels might be at. 10 to 14 equaling sort of a minor depression, 15 to 19, a score of 15 to 19, a more major depression, and over 20 more severe depression. So that sort of gives them a guide as to what sort of resources, what sort of help you might need, and also you too as to where you're sort of doing. So yeah, that's what that sort of looks like. And that's, again, all those sort of signs and symptoms of depression there. Okay. Anxiety. Let's talk about anxiety a little bit here. So anxiety is a general term for response to stress that is a cause to the nervous system of fear, apprehension, worrying. They say depression is a fixation on the past and anxiety is a fixation on the future, so worrying about the future. It's a normal reaction to stressful situations, right? It is a normal human reaction. It has a purpose. It protects us. When we hear a lion growl and we see it's connected to a big creature with big teeth and sharp nails, okay, we get that pit of anxiety. So next time when we hear the lion roar and we get that pit of anxiety and fear, we know to get the heck out of there. So it can be good. It can prepare us for certain things. Many of you probably have had anxiety in the past with preparing for something, like a presentation that you have to give to a prostate cancer support group. You might have some anxiety relating to that preemptively. Anxiety can help us prepare, and so I spent time today preparing a slideshow to make sure I knew what I was talking about. So it can be helpful in certain situations, but it's when it takes our nervous system up here and it keeps it up here. And we don't have that nice baseline anymore. It's when it keeps it up here and we're anxious all the time and we can't lower that. That's when anxiety becomes more problematic, and we've got to look at more ways, more tools to help counteract that. So anxiety is considered to be a problem when symptoms interfere with ability to sleep or function or, again, have quality of life. Same with depression. It's okay to be sad. It's not okay if the sadness is disruptive to our quality of life every day for a long period of time. So, coping with anxiety. What are some strategies we can do to decrease that, settle that nervous system back down here? Well, mitigating the catastrophe, looking at the extremes. Often when we have anxiety, we are looking at an extreme. We're good at that as humans. We like to see the worst of the worst outcome. Again, that's a preparatory mechanism. If we see the worst of the worst, then we know what could be a possibility and how we could prepare for it. However, again, becomes problematic if our brain stays stuck there. So, if we take the worst of the worst, then let's look at the opposite. What could be the best of the best? And then usually reality is following someplace in between. So take the opposites there. Utilize grounding techniques. What I mean by grounding techniques is anything that takes you back to the here and now. So anxiety, again, that fear of the future, it is our brain saying, what if, what if, what if, what if, what if? And it gets on this roll. It's like a train. Once it gets going, it doesn't stop. So, using grounding techniques, little techniques that take us back to the here and now, that make us focus right here on what's happening right in front of us. So a good one is this 5, 4, 3, 2, 1 technique, looking in the room around us, finding 5 things that we can see, 4 things that we can hear, 3 things that we can touch, 2 things that we can taste, and 1 thing that we could smell. So going through the 5 senses, that's a simple thing. Or taking something right in front of us and focusing on it and describing it. I see a picture frame. It's got a black picture frame. Around it, it's got a white center. It says guest Wi-Fi. It has the password in it. The password is this, so on. So just focusing something on the here and now. Deep breathing. Deep breathing is a great one. Deep breathing is actually a really great one as well if you are having a hot flash too from that androgen deprivation therapy. Slows our heart rate, which also reduces our body temperature as well. So deep breathing, counting in to the count of 4 through the nose, and out through the mouth to the count of 4. So doing that for a period of 30 seconds, 1 minute or so. Again, slowing down that heart rate, focusing just on the here and now. Again, cognitive behavioral techniques, that's something that myself and other therapists work strongly with, using reframing techniques, so thought stopping. So we'll literally say, okay, what is that thought that is popping up in your head? Let's take that stop sign, put a big stop sign right in front of that, and then maybe what is the opposite thought of that? Or what could you see positive in that? Mindfulness and meditation. So you might have heard of this before. There are tons and tons of mindfulness and meditation videos or audio tapes that you can get from the library, or if people are tech savvy, YouTube or on websites and things like that. There's a great one by the name of Tara Brock, a therapist that has a whole big collection in her library that's completely free as well. So mindfulness, meditation, again, mindfulness just means bringing your thoughts to the here and now. And so you might want to listen to a guided meditation, something that says, picture the beautiful sands and the ocean of a beautiful beach in Mexico where it's not minus 45 and is a beautiful balmy 32, which we won't experience in Saskatchewan for another 4 months. something like that. Or they might take you through a guided body meditation. So starting with the tips of your toes, wiggling those, tensing those, working your way up to the foot, going to your ankle, rotating your ankle, and working your way throughout the rest of the body. Again, focusing back to the here and now. So some techniques for anxiety here. Anger, short temper. Anger could be displayed at your loved ones, at the medical system, at those that care for you, that are supporting you. Anger towards the cancer. Oftentimes, anger is a surface representation of other emotions that are going on underneath. So fear, sadness, loss of control, grief, that might pop out as anger. So sometimes the question, if we have angry outbursts, is, was I really angry at that? Or is there something else that is going on beneath that? Anger can be fueled by personal beliefs about yourself in a situation. So these are some guiding questions that can be really helpful if we have sort of angry outbursts, sort of breaking that situation down and that response down and asking yourself some questions about that. What is the evidence for this belief? So why am I angry about this particular situation? Does this belief look at the whole picture? Does it take into account other sides of the picture? What is the opposite perspective? Is there any truth to that? Does this belief promote well-being and peace in mind? So why am I holding on to this? Is this thought and is this belief beneficial for me in the long run? And what is a positive affirmation that I could take from this? So is there something positive about this situation that I can find despite the anger? Can I find anything positive from that situation? So those can be a good set of questions for breaking down that anger as well. Grief and loss. That is a big one with a cancer diagnosis because we are often grieving our former selves, grieving those bodies that we were once used to, that have now changed. Grieving changes to appearance, grieving to loss of sexual function, grieving to loss of maybe connections with partners or changing connection with partners. And yeah, that self-identity. Coping with grief. First and foremost, give yourself permission. Give yourself time. Make space for it. It is okay to sit in those feelings. It might be uncomfortable, but sitting with those feelings for 15 minutes a day when you choose is probably better to have that uncomfort in that situation than having that grief pop out as anger or another emotion when you don't want it to pop out, when you're public speaking in front of a prostate cancer support group. So carve out a little bit of space for that. It might be sort of the 15 minutes a day, sort of as you start your day or as you end your day, or a quiet time when you know you'll be alone in a comfortable space. Sit with that. Think about your journey, your experience, what you might be grieving. How will you mourn the person that you once were? Think about how you will grieve as well. What can you do to celebrate? So that could be, some suggestions are writing a letter to your former self, writing a letter to that cancer. So asking yourself, what can I do to display that grief, to share that grief? What can I do to mourn? What will be a representation of that when I carve out that time for myself? Forgive yourself as well, and forgive other ones as well. Practice that forgiveness. Make hopeful plans for the future. So think about what our future does look like. It might not look exactly like how we pictured 10 years ago, 5 years ago, but there is still a future that we can carve out. And what does that look like for ourselves? And be patient. Grief is not linear. We have, many of you might be familiar with Elizabeth Kubler-Ross, who specialized in grief, and she wrote a book a number of years ago, and that was sort of the guidebook, and she put forward these steps of grief. And people sort of thought of that as a linear process. Okay, first we'd go through the sadness, then we'd be angry, then we would deny, we'd be in denial sort of thing. Well, she didn't mean that for that to be this strictly linear process, but sort of different steps that could be involved in our grief. So there is no precise timeline. Everybody grieves very differently. It will look differently for each person. So sometimes you might hear, well, aren't you over that yet? Or you might have, if you've been to a funeral where a loved one passed away, well, oh, that was like a year ago. You're happy now, right? Like, everybody's grief timeline works differently, and there's no precise timeline. So yes, it's not linear. This is my favorite representation here. So the one on this side here, I guess it would be, you're right, is sort of that typical picture of linear grief, going from shock, numbness, denial, fear, guilt, and then to new patterns, affirmation, helping others, the loss adjustment, very linear. When in reality, it looks a lot more like the one on the left, because there's triggers in our environment. There might be days where you're feeling, this is a really good day. I'm okay with the fact that I have prostate cancer, and I'm having a really good day. I'm having good energy. I've been coping well. And then the next day you hear a commercial for prostate cancer, or there's a song that reminds you about your treatment, and suddenly you're at the bottom of the barrel again. That is grief. And it's not about not experiencing those feelings. It is about having those feelings, making space for those feelings, and then continuing to grow around those feelings, so that eventually, hopefully, that our cancer is sort of that little voice on the shelf, that it sits there. Every once in a while, it pops its head out, says, hi, hello, remember me? Remember how much I disrupted your life? And then we can say, okay, yep, I've got you, I see you. Let's put you back in the box over there and continue to grow and enjoy our quality of life outside of that. Caregivers. I don't want to forget about the caregivers in our life and in the room here. Caregivers can feel these same emotions that we're going through as well, just as intently, especially if they are walking hand in hand with you, alongside you, because they experience that firsthand with you, what you're going through, and their own grief, their own loss, their own anger at the cancer, and their disruption to their dream with you. So again, numbers and studies here if you're looking for research. Studies of psychological distress in both patients and caregivers found psychological distress of patients and caregivers was parallel over time, ran side by side, and helping family members to manage their distress had a beneficial effect on the distress level of the patients. I would say, well, of course. So yeah, very important that our caregivers, our loved ones, are also taking care of themselves, and also watching and managing for these mental health changes in their own selves too. Coping tips. So I did give you a lot of sort of coping tips when we talked about the anger, the anxiety, and so on. Other things, create a coping toolbox for yourself. So what things make you feel good? You can even have like an actual toolbox if you'd like and have things written down for yourself as reminders. What does making myself feel good look like? Is that taking a walk? Is that cuddling with my puppy? Is that going to the gym? Is that taking a nice warm bath? Is that going to a movie with my loved one? What does that look like for yourself? Write those things down and have a nice little toolbox of coping skills that work for you. So when you're having that tough day, you can flip open that box, pull that tool out. Utilize one of those tools for yourself. Writing lists of concerns, hopes, fears. Again, that journaling or writing things down can be really powerful. Again, getting everything that's in here and here out there. We don't want it under the rug. Create SMART goals. So you probably have heard of SMART goals in sort of the corporate world, staying away from the corporate world, but goals that are timely, that are measurable, that you can incorporate in your life. So if you have something that has been really causing you a lot of anxiety or a lot of distress or a lot of anger, okay, what can I do about that? Is there an action plan I can take to move forward with this, to do some change in my life? So yeah, maybe that goal is to incorporate some exercise for my mental health. Okay, so what does that look like? Okay, I am going to go for a walk 3 times a week. I am going to go for a walk around the block. I am going to do it with my spouse, or if my spouse isn't free, my dog. What might get in the way? The -40 temperature. So if that's the case, then I'm going to go to the mall those days and walk. Why is this important to me? For my physical health and my mental health. The what might get in the way and the why is this important to me? Most important, because if we think about those things beforehand, then we're prepared for them when they do come up, because things will come up. And again, writing these things down, putting it on paper, much more likely, if we write that down and we share it with people, we're much more likely to execute it. Remind yourself, yes, cancer is a part of your life, but it's not all of your life. And the reason why we're getting cancer treatment is that we can have quality of life as well. So we want to maximize on that quality of life and live every day. We want that quality of life to have the best day we can every day. So what does that look like to you? And how, for you, can you get the best day out of every day here? I always like to end with, this is a really nice quote from The Human Side of Cancer by Holland and Lewis here. Lovely little book, written in 2000, so a little bit dated, but still a very nice book here. The diagnosis of cancer creates a sense of urgency about the time that goes along with the uncertainty it causes. However, the person who can say, I'm just going to take it one day at a time, is able to focus on the task of that day. The person who hardly enjoys today because of the concerns and worries about tomorrow has a much harder time dealing with illness. Hard as it is to keep thinking that way, coping with cancer is easier if you try not to focus on the challenges that might lie ahead, but rather stay focused on today, be mindful, during which you can accomplish something despite the problems caused by the treatment. And those are other great resources in our community here as well as online. And another really great book, Picking Up the Pieces by McGee and Scalzo as well here too. So yes, by all means, you can always access a Cancer Centre social worker, myself and my colleagues. If you don't know of a social worker that is attached to you, there's the phone number. You can can contact our main phone number and ask for one of us. There's also wonderful counselors in the community. If you do have sort of an extended health benefits program that does cover counseling, you can access private services, or there's two services there, Family Service Saskatoon and Navera Community Connections, that have a sliding fee scale, so based on your income is what they charge. And Wellspring is a great online resource for other sort of group supports, and they have a wealth of different classes. They have a chair yoga class, they have a breathing class, they have a caregiver group, they have the abundance of different online groups and resources there too. So yes. Questions?
Just a comment.
Yes.
The bulk of your symptoms are almost all related to androgen deprivation, aren't they?
Can be. I mean, having a cancer diagnosis in itself can cause fear, anxiety, depression, all of these things, So you can have mental health concerns with just having a cancer diagnosis itself. I provide a lot of counseling for individuals where their treatment has nothing to do with any hormone therapy and changes. But yes, ADT can, for many people, be a huge trigger in emotional changes, absolutely. So yes.
More questions?
Hey, is there studies on age group if they were diagnosed with early stage? I mean, maybe 40s diagnosed with cancer, and maybe obviously my age is far from the others. So, is there a risk factor?
In terms of mental health impact?
Yeah.
That's a good question. I haven't really looked into that necessarily. We know that that it's different. It's very different, right? The experiences you have as someone who is retired is very different than experience when you're working full time. Very different from when your kids are grown and out of the house versus if you're raising children and what that looks like. So there's different psychological impacts. Now, the experience and the emotional impact can be the same, can be equal and just as powerful, but it can be different. So I don't know numbers on that. We do know too that with that androgen deprivation therapy, because I think Murray asked me to speak a little bit more on that tonight. We do know that with lower age versus those that are older, there seems to be a little bit more of an impact of side effects with the androgen deprivation therapy, with the hormone therapy, because there tends to be a larger drop in testosterone. So as we age naturally, our testosterone does drop naturally. So if you're going from a sort of a smaller level of testosterone naturally, your drop might not be as significant. With that said, everybody is different. So doesn't always hold across the board. So I've given you a very murky gray answer.
I had anxiety when I was on the ADT, and didn't tell anybody. And then I got real bad one night and I phoned 811. And I can't remember why, but I called them twice and I got two different nurses and they were both very helpful.
Awesome.
And they hooked me up with Wellness Together, which is a cross-Canada thing.
Yes, that's a great resource as
And I
well.
talked to two different people there, and they were wonderful. And they arranged for me to see a counselor in Saskatoon.
Fabulous.
And I told him what was going on and what I was thinking. And he said, "Is your wife there?" I said, "Yes." And he talked to her and said, "You get him to the hospital right now."
Yeah.
We went to City Hospital where there's no psychiatric
No
help. We
psychiatry,
didn't know
yeah.
that when we went,
Yeah.
but the doctor there was very, very good.
Yeah. Awesome.
And he put me through and he said, "I can get you to see a psychiatrist on the rapid access,"
Great.
which at that time was 2 months.
Yep.
And you're saying it's longer now.
Yeah.
And that counselor was very good. He helped me a lot.
That's amazing. That's wonderful.
I only talked to him about 3 times, but he suggested we go, and we did, and
Awesome.
eventually I got to talk to a psychiatrist who wasn't as helpful as all the 811 and the
Sure.
Wellness Together and the other
Sure.
doctor that I'd seen.
Right. Right.
But 811 is so simple, you can just dial it and
It's a great resource.
they tell you right off that they don't have any psychiatric statistics or abilities, but
Right. Right.
just talking to them calms you down.
Yeah. Yeah. Well, it's somebody there, somebody who
Somebody
will
there,
listen
yeah, and they were
who can connect you, who can start that process of connecting
and
you
they
with the
were
right
all
resources.
sympathetic,
That's great.
very nice people.
Good.
At that time, I didn't know you could call the cancer center.
Yeah. Yeah. Well, see, you can, but we operate 8 a.m. to 4:30, so
Yeah, well,
sometimes not quite when you need
Yeah.
it, which is a great point to mention that 811 is a fabulous resource. In our city, we also have mobile crisis. I should have their phone number memorized, but I don't. But they're also a fabulous resource if you if you have emergency mental health concerns and need to connect with someone. They're also a great resource that actually they can even come out to your house if there is a very emergent concern. And even bring you to the hospital if needed as well. So they're a great resource too. Yeah.
Thank you.
Thank you for sharing.